초콜릿은 달콤해 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 오렌지는 상큼해 상큼해 상큼해.
Good day everyone, I'm Chelsea Batallones and I will be discussing about osteoporosis. So what is osteoporosis? It is a metabolic skeletal disease characterized by low bone density and microarchitectural deterioration of bone tissue, which results in increased bone fragility and susceptibility to fracture. The vertebrae, wrists, and hips are the most common sites of fracture. So this is the picture of the normal bone and osteoporotic bone. So sa normal bone, it looks like a honeycomb. Then sa osteoporotic bone, have lost density or mass and contain abnormal tissue structure. So makikita nyo naman dito na sobrang luwang na talaga yung space ng buto. So these are the risk factor: female more than male, female gender, Caucasian or Asian race, thin and small body frames, and the family history of osteoporosis, or having a mother with an osteoporotic hip fracture doubles your risk of hip fracture. Then next, increased age. So, kapag increased age, syempre, degenerate na din yung work ng bone natin. Then next is inadequate intake of calcium and vitamin D. So, low calcium intake contributes to diminished bone density, early bone loss, and an increased risk of fracture. So, kapag inadequate intake ka din ng vitamin D, syempre, yung vitamin D is siya yung tumutulong sa body natin para mag-absorb ng calcium. So, kapag yung vitamin D is lack sa ating katawan, is hindi niya ma-absorb yung adequate amounts of calcium para ma-prevent yung osteoporosis. Then, next is estrogen deficiency or menopause. So, low estrogen levels such as occur in menopause or with early surgical removal of both ovaries. Another cause of low estrogen level is chemotherapy such as for breast cancer, and chemotherapy can cause early menopause due to its toxic effects on the ovary. Then next is family history. So as I said earlier that having a mother with an osteoporotic hip fracture doubles your risk of hip fracture. Then lack of physical activity. Exercise encourages bone development, and lack of exercise means you'll be more at risk of losing calcium from the bones and no developing osteoporosis. Then smoking, alcohol consumption. So smoking in any amounts has a detrimental effect on bone density, while in the alcohol intake of greater than 3 ounces per day or about 2 to 3 typical drinks has been shown to increase bone loss. Then next is medication like corticosteroids and anti-seizures. So certain medications can cause osteoporosis. This includes heparin, a blood thinner, anti-seizure medications, phenytoin, dilantin, and phenobarbital, and long-term use of corticosteroids such as prednisone. Then next, low weight and body mass index. So ito yung mga So, dito, maapektuhan din yung bone density, then Caucasian or Asian, so like the family history din siya. Then next is causes of osteoporosis. Idiopathic age-related osteoporosis, most common young adults. So, most common siya sa young adults kasi it sometimes affects young people including premenopausal women in their 20s, 30s, and 40s. The term premenopausal refers to women who are still having regular menstrual periods and have not yet reached menopause. Then second, postmenopausal type 1. So postmenopausal women are susceptible to primary osteoporosis since osteoporosis is closely related to estrogen deficiency. During the menopausal transition period, the trap of estrogen leads to more bone resorption than formation, resulting in osteoporosis. Then senile type 2. Primary type 2 osteoporosis is also known as senile, commonly caused by a long-term calcium deficiency. Women are twice as more likely than men to suffer from type 2 osteoporosis. Then osteoporosis secondary to disease states. First, metabolic conditions, example, calcium deficiency, vitamin D deficiency, malnutrition, scurvy. Then second, endocrine conditions, example, hyperparathyroidism. Third, renal disease. Fourth, gastrointestinal liver disease. Then fifth, bone marrow infiltration, example, leukemia.